us, maintaining immunizations was tops on the list of our customers' needs even as we relocated the district offices. Stephanie Bethel has a report for us now on the resurgence of a vaccine-preventable illness that targets the very young.
Nationally and here in southern Nevada, we are seeing a dramatic increase in the number of cases of pertussis, more commonly known as whooping cough. Pertussis is a very contagious bacterial respiratory disease. Although it can be a mild illness in older children and adults, it can result in serious complications and hospital stays for younger children and infants. Some serious complications include severe respiratory distress and inflammation of the brain. In rare cases, pertussis can result in death, especially in children less than a year old.
I think when your immunization rates as a nation are very high and they the diseases become less evident, you start lulling yourself into a false sense of security. And I think what happened in California is a very good example of that. Having 9 infants die last year from pertussis, a needless death, because of people making choices due to the publicity that was out there about, warning them about vaccines and them heeding that advice. We saw a lot of families choose not to vaccinate, and what did California end up with? The worst pertussis outbreak we've seen in a very long time, and 9 children dying. And I think that's a very good example of using that information to say that these diseases still are around us, and this is what can happen if in fact we allow immunizations to fall off. So it's an opportunity to cease an educational opportunity for families and realize that these diseases still are there.
We have a problem for several reasons. It's not as easy a disease to vaccinate against because it requires multiple doses. Children have to get 5 doses before they're considered fully vaccinated, and that does not finish until about ages 4 through 6. So, and then children do not get their first doses until age 2 months. So the doses are at 2 months, 4 months, and 6 months, and then one again at ages 15 to 18 months, and the final one occurs between 4 and 6 years. So the children that are either partially vaccinated or not vaccinated, which would be mostly infants, are at a higher risk than the average child or the average adult for acquiring pertussis.
Prevention against pertussis relies on a concept called herd immunity. Since newborns can't begin their vaccinations until the age of 2 months and children aren't considered fully protected until they're about 5 years old, it's important that everyone else in the community is immunized. Herd immunity protects the community's youngest members.
The idea of the herd is to protect everybody who's around the infant. There's a term that's used also which is called cocooning. So that is an approach that's been taken prior to the birth of a child, where medical community recognizes the people who will be in contact with those infants and then reaches out to offer immunization to all of those people so that everybody is immunized before the child is born, and then the child, when it's in the most vulnerable state during those few first months before it can be vaccinated at all, and before it's vaccinated with multiple doses, is going to be protected because the people around the child are protected.
It's most critical for an infant's family members, including the adults and older children, to be vaccinated because of their close contact with the baby. But it doesn't stop there. Daycare workers, babysitters, grandparents, and relatives, anyone coming into contact with infants should be vaccinated.
At this point, it's only recommended to get a Tdap one time as an adult, and then you're considered to be vaccinated. That vaccine's only been around since about 2006, so not everybody really has had a chance even to go get it. And we believe that only 6 to 8% of the whole population, the adult population in the U.S., has had a Tdap shot. So there's a lot of opportunity to get more vaccinations among the adults. And we particularly want to get the message out that adults who are around young children, particularly those around infants, be vaccinated with the Tdap at least one time, and they don't have to wait for their next tetanus booster time to go back. They should just get it now.
Just get it now. Good advice. The numbers tell us very few of you watching have had a Tdap booster because for adults, it's a relatively new vaccine. A Tdap shot protects you against pertussis and tetanus, a good thing to do for your own health. But look at it this way. By protecting yourself and your family, you're also protecting our community and babies who are not yet able to be vaccinated. And here's another idea. Flu season will soon be here. This year, when you make the time to get your flu shot, why not get a Tdap booster at the same time? Tdap only has to be administered to an adult once, not each year like a flu shot, but it goes a long way in protecting Southern Nevada's children.